We see this scenario every day in our clinic. It starts with a dull ache, you take a painkiller and it goes away. And you feel, okay, I can manage this. But after 2 days, the pain comes even harder. You take the same medication, but this time the pain doesn't go away. You wait for an hour, it is still throbbing. You might be even tempted to take more than recommended dose, but the pain just won't touch the brain. Hey everyone, I'm your super dentist and welcome back to my channel. Ever notice that your painkiller suddenly fail? It's not because your body has built up tolerance or your painkiller is weak. It's because of the unique physics of your tooth. Today I'm going to explain exactly what happens. Let's dive in. To understand why your pill stopped working, we need to look into the inflammation. Imagine you sprain your ankle. It swells up, becomes red and becomes puffy, right? That swelling is because your body is sending blood and immune cells to fight that injury. Because your skin is stretchy, the skin has room to expand. But let's come down to the tooth. The living part of your tooth, that is blood vessels and nerves, is trapped inside a pulp chamber. Now this chamber is surrounded by a hard dentin and enamel. It's essentially a room with a solid stone walls. So when the nerves get infected due to the bacteria, it will try to swell up like an ankle, but it can't. The pressure has nowhere to go because it is trapped inside a hard shell. This creates what we call as a closed pulp chamber effect. Think of it like a pressure cooker. As the infection grows, the pressure inside the tooth chamber skyrockets. This pressure physically crushes the nerve endings. Here's why the medication fails. The painkillers works by blocking the chemical signals to your brain. They are great at handling the chemical pain, but once the pressure builds up inside the tooth, the nerves is crushed. Now the pain becomes mechanical. It's the physical pressure that is compressing the nerve. No amount of painkiller can unsqueeze that. It's like the painkiller is whispering to your brain to stop the pain, but the pressure inside your tooth is screaming through the megaphone. This is the most dangerous phase for the patient. When the normal dose doesn't work, they think, okay, I need to take more. Please don't do this. Overdosing can just increase your gastric issues. It still won't stop throbbing. Remember, painkillers are just masking the signals. They are not actually killing the bacteria, which is the cause of the pain. They are like putting a tape on a fire alarm. The fire, which is bacteria and inflammation, is still burning. Eventually, the fire becomes too big for the tape to hide. The bacteria is still eating away at your tooth structure regardless how much pills you take. The only way to stop this kind of pain is by releasing the pressure. That is why when we do a root canal, we open up the tooth. We drill a small tiny hole and that releases the pressure. The patients feel immediate and massive relief the moment we reach the pulp space. It's not magic, it's physics. We are just popping the balloon. If you like this video, please share it with your family and friends and help me to spread the awareness. If you have any queries, please let me know in the comments below. I would love to answer your questions. Do not forget to like and subscribe. Thank you for watching. See you in the next one.